Hi, and welcome to Align Modern Health's digital doc introduction to herbal medicine. My name is Rania Abusamra, and I'm a licensed acupuncturist here at Align Modern Health. And I am super excited to be here today, sharing my love for herbal medicine with you and Chinese medicine. A little bit about Chinese medicine, or just generally what we're going to be talking about today. The reason why we're connecting all of this is that because we do have a unique, interesting system within Chinese medicine that allows us to diagnose and treat certain conditions with herbal medicine. So aside from that, I think I could probably get started. Awesome. So a little bit about Align Modern Health and what we do here. Align Modern Health is a Chicago-based #1 clinic that offers alternative medicine and support for people coming in. Our different services include chiropractic, physical medicine, acupuncture, clinical massage therapy, functional medicine, and clinical nutrition. We have an interesting model here, and one of the reasons why I'm here is because I get really excited about co-treating conditions and working with different, very skilled practitioners and looking at the root cause of issues that are showing up for patients that do come through our door. So thank you again for being here, and we're going to get started. So just introduce myself. My name is Rania Abusamra, and I started off as a psychotherapist before I started working in the medicine. I worked for about 6 years, and I started getting curious about different conditions that were surfacing and treating them more holistically. I was curious about the folks who were looking for alternative support and weren't really excited about medication and didn't need medication. And so they were coming to me for more than just mental support. And I was starting to get excited about, okay, what are some lifestyle changes that I could actually suggest? One of my issues is it wasn't within my scope of practice. And so I started thinking about different alternative forms of medicine that I could study to be able to support people that I wanted to work with. And so I came across Chinese medicine, and the rest is history. So some of my passions include digestive disorders, respiratory concerns, reproductive issues, musculoskeletal pain, mental health concerns, and herbal medicine, of course. And finally, more recently, men's health. All right, so a little bit of history for context. So Chinese medicine has had one of the oldest medical systems or records of some of this medicine that has been around for about thousands of years now. And some of the concepts that originated within Chinese medicine existed within different traditions, but the way that they were framed in Chinese medicine was very unique. It is a science in and of itself. And when we talk about Chinese medicine in the Western world, some of the people have heard the stories about, acupuncture treating musculoskeletal pain. And then you hear about the other side of the story, which is the esoteric spiritual aspect and people that get excited about it through having studied different types of Asian spirituality. And for us, within this context, we're going to be talking a little bit about the medical aspect of it that includes musculoskeletal issues. Maybe not as much focus on that today, but still it's a part of the medicine. And also the esoteric part still remains a part of it in the major concepts, but we're going to see how those concepts translate into our medical world. So Chinese medicine usually looks at the body as a part of this entire environment. So we live as humans are microsystems of this, larger surrounding universe. You've got, we are interacting with everything else around us. So things that are outside of us are reflected within, and things that are within are reflected without. So there is continuous communication. And that means that we either have an opportunity to lean into that harmony, or we back out of the harmony. And over time, this harmony can either increase or decrease. So we are moving with these cycles of change, and we can either choose to lean into change and accept change as a concept that is important to our health, or we can resist. And through resistance, certain physiological things can shift in our body and can cause what we call disease. And of course, we're going to be looking at different elements and forces of nature that are a part of our concepts that allow us to diagnose and treat disease. So another function or another aspect, pillar, concept that we're looking at today is Qi. So Qi is something that you hear about. So many people talk about Qi. It's all over the place. You know, people talk about it as energy, and you hear all sorts of concepts about it. For today's purpose, and Qi has been defined as the smallest functional unit that we find everywhere around us. We're going to find them in our organs. We're going to find them all around the universe. We find them in our human bodies. And this Qi, not only is it functional unit, but it is also a concept of change. It's a concept of function, just simply function. So we look at this Qi that moves through the body, and whenever there is imbalance in the body, the Qi does not move properly. And so a lot of, in our medicine, what we're trying to do is move that Qi properly, allow for function to move in the way that it needs to for our bodies to remain healthy. And another theory within our medicine is the theory of yin and yang. Yin and yang you may have heard of through conversations about gender expression. You know, we use it very often to talk about femininity and masculinity and some, you know, abstract concepts. And they are still, those concepts are still a part of Chinese medicine. But for the purpose of today, we're talking about how yin and yang are actual substances and functions in the body that allow for this body to stay in harmony. And they are central to how we understand diagnosis. So more simply put, an example of what yin could look like, or some of the characteristics of yin, could be stillness, could be something that is more substantial, like blood. Yang could be the way that blood moves. So when we talk about them in our medicine, we have categorized all aspects of the body into those categories so that we simplify how we look at things and can treat things pretty quickly. Okay, so that being said, why are we talking about diagnosis? Diagnosis is really important in how we choose our herbs. And when we talk about Western medicine, or Western medicine's interest in herbs, generally, it's a little different than Chinese medicine. Not good, not bad, just different. Chinese, when Western medicine looks at herbs, we're looking at different clinical trials, and they're always looking at single herbs. And the way that they look at single herbs is they go, okay, so you've got someone, a bunch of people who got diabetes, so we're gonna try and give them this one herb and see how it works. So then chances are that this herb is going to work for 500 people is you know, lower sometimes than higher. So then what they end up doing is you'll hear disclaimers about how this herb may be supportive, but it's not really. We've seen some evidence, but not a lot. So the interesting thing about Chinese medicine and how we step into that is that we look at everything, we start looking at these herbs a little differently. So one, and I'll say it very simply, one person, two people could have diabetes and they could use different herbs. So when we treat someone, we're looking at patterns in the body. We're looking at yin and yang. We're looking at, is there cold, heat, interior, exterior, excess, deficiency? I'll talk a little bit more about that too, but are those concepts there? And with this herb, will this herb that has all these characteristics that we have also categorized, will it be able to treat this one person? And so, and again, we're not just using one herb, and we'll go into a little bit about how we actually process the herbs and where we put them and how we give them to our patients. But this is why diagnosing disease is important in Chinese medicine, or traditional Chinese medicine. So as I've mentioned earlier, all disease is caused by the imbalance of yin and yang, and is due to either external, exterior, or interior and internal factors. And that also, that's me repeating myself and me talking about how we are connected to our environments, and our bodies are interacting, are responding to what is around us. So more simply put, if you look at the slides here, we've got wind, cold, heat, and dampness as concepts that we use, and dryness as concepts that we use to understand how disease goes into the body. Yes, they look like they could be meteorological or weather-related terms, and they can be. So when we talk about exterior factors or pathogens going into the body, we can say that this person has wind cold. So I'll give you a very simple example. The more simple example, someone who's got arthritis. There are many people who, when it rains and it gets colder, their arthritis gets triggered. And this goes back to what I was talking about when I was saying that we reflect what's outside and what's outside reflects within us. So this concept of wind, cold, damp can exist in our body and it actually exists outside. So whenever we check the body and we notice certain symptoms, we are able to understand that this person is actually being affected by the environment and may have an actual constitution or issue in the body that is also being triggered by the environment. So we're understanding wind, cold, damp as, yes, they may look like abstract concepts, but they're also physiological in the body. Outside of that, I would also add that they could also look like wind, cold could look like a virus infection in the body. So that can become a little bit more complicated, but those are some of the examples of what exterior and external could look like. Interior and internal generators of disease, I'll be a little, this is a lot simpler to look at, but it could look like emotional stress that could cause imbalances of hormones, cortisol levels increasing, causing all sorts of imbalance, improper diet, so the foods that we eat. So this one's a lot more simpler to explain. Perfect. So again, the goal of herbal medicine is to help the body heal, and we're dealing with eliminating these concepts to create harmony in the body. So herbal medicine. Herbs are everywhere. I mean, we see them everywhere. I think if you're walking down the streets today, you're probably going to see dandelions flying all over the place. And I always like to set an intention when I'm doing presentations or talking to people, because it's important. It's an important part of my practice. And one of the intentions today that I wanted to set was thinking about what herbal medicine has taught me, or herbs. And I think for me today, the biggest theme was resilience. And I wanted to share it with you all because I know a lot of you are coming in today. You may have had certain experiences in your bodies. You may have struggled. You may have faced adversity. And one of the most beautiful teachers for me has been herbs through those times, for me, myself, and my patients. And I think herbs are great teachers in that way, in that they show us that there is resilience, that because of the way that they exist and they continue to exist in our world, no matter how much we push them away, those herbs are still going to continue to grow. And it just reminded me of that as I was walking to work today, and I could see those like dandelions like flying, those dandelion flowers like flying, the seeds at least flying into like around me, and I felt this moment of excitement where I was just like, this is it. Like we have everything we need around us. The universe is continuously there, reflecting or talking to us about how we exist here. We are here as a part of it. So, okay, perfect. Herbs. So they may include different parts of plants, such as leaves, roots, stems, flowers, seeds. I'm going to include some animal matter and some minerals too in Chinese medicine. What makes it different, Rania, from nutrition? The nutritional piece is well, what makes a difference is the fact that herbs, we process them a little differently than the food that we might eat. And the actual processing of it and the amount of it is what's going to turn them into herbs. And the way we process them in the body is what makes them herbs too, through the liver and the kidney. And so the herbs are never really, in Chinese medicine, they're never given as single herbs. They're always given in formulas. And that's what excites us most in this medicine, in that we are looking to make sure that you as an individual, you have different things going on in your body, and one herb may not be beneficial or just beneficial. Like we're going to be looking at how is it that this entire family of herbs that we have categorized, and we're going to talk about the different categories of herbs, but we have put these herbs into certain categories, and now we're placing them into formulas specifically for this one person that is in front of us, and it will look different. Yes, some people may get the same formula, but we do modify them. And there's been thousands of years of records of trial and error in our medicine, where we see the records and the results of what herbs have done for so many different conditions that are described in different trials and cases that we read about. So it's pretty exciting to be living in this time and being able to have this wisdom and this amazing opportunity to be able to practice based off of amazing, incredible teachers that I've had in my life, current, and having access to past ones. So yeah, what we're looking at here on the slides, you'll see base incompatibility or incompatibility of each herb. So some herbs may not go together, the specific dosage, as we've mentioned, any restrictions, prohibitions, and the needs and makeup of each individual. So again, very customized. And we are going to now look at what are some of the categories, or at least how the medicine has categorized herbs for us to be able to link diagnosis with treatment. So one of the categories is temperature. So you've got more basically hot, warm, cool, cold. And so herbs will generally fall into these categories. So an example of hotter herbs. Here's a concept about like herbs that are young in nature that could stimulate the body. So turn the body on, activate it, awaken it, help fight external pathogenic factors. So, you know, you've got some hotter herbs that can help with, support the environment when there is a viral infection, for instance. You've got cooler herbs that are more yin in nature and they offer more inhibitory effects. So they can help with resting, relaxing, and cooling the body. So I think of like summer heat sometimes and how people run to their ice cream or they run to their really cold water. Simple, cool herbs can actually support people in cooling down their bodies without having to run to ice cold water. So another taste or outside of temperature, we're also going to be looking at taste. So when we categorize our herbs or think about our herbs, we're thinking, okay, will this be an herb that is too hot for someone? Will it be too sweet for someone? What is their diagnosis? So some herbs are acrid. So by acrid, they're moving. They disperse. So they could help with blood circulation. They can help with moving energy in the body. They can help with the digestive system, the peristalsis of the body. So like moving your bowel movements. You've got, for instance, examples of chenpi, orange aged tangerine peel. Chenpi is an amazing digestive herb. Of course, there are other functions, but that's one example. And guejo cinnamon twig. So, I mean, we've talked about how there is a slight difference in nutrition and herbs, and that's through different ways of processing them. But we do use herbs in our everyday lives. So that's an example. I mean, we use cinnamon bark, but this is a little different. And in our medicine, they do have different characteristics. But yes, cinnamon twig is definitely an herb that is very, very powerful that gets used to awaken certain systems in our body too. We've also got sweet herbs. They normalize, they tonify, they nourish, and you may have already heard of renshen ginseng. Very, very powerful herb that just really, really energizes the body. And huangqi, similarly, definitely very, very supportive for the immune system. Perfect. And now we've got sour herbs, astringent herbs. So they stabilize and bind, prevent the loss of body fluid. So wu wei's very popular Schisandra in our formulas. This herb is incredible in that it allows, I think of like, more simply put, like someone could be sweating too much. So you've got hyperhidrosis, you're running around and you notice yourself outside of everyone else around you, you may be sweating the most. And wu wei's, again, it may not be appropriate for everyone else because there's different reasons why we sweat, but wu wei's can be a really good stabilizer and binder. We've also got bitter herbs that drain and burn. So they eliminate I'm just going to stop at eliminate different things from the body, and they can offer an antibiotic effect. But an example would be huangyan coptis, and it's been used. It can be used for different types of diarrhea, not all, but some forms of diarrhea. And dahuang for also some forms of constipation, rhubarb. So lastly, we've got some salty herbs. Salty for softening. They soften hardness in the body, like nodule tumors and swelling. And when I think of salt, I think of osmosis. So we've got, I think more basically you can think of, so why would this herb be useful? I think of like, eating too much salt and then actually getting dehydrated. So you think of osmosis in that sense, in that the water is going to go, just like the entire universe is interested in harmonizing things, the water is going to do the same, and then the water is going to go where the salt is. So this is how you would end up softening, for instance, hardness, nodules, or tumors. And again, dosage matters, the type of salt. So we're talking about Mengxiao sodium sulfate is going to matter when we're adding it to formulas. Perfect. So we're going to also be looking at administration of herbs. So the administration of herbs is almost equally as important as the different tastes and temperatures when it comes to diagnosis and how we want to treat people. And some of our older texts will show us that certain people may need different administration of herbs. So some people may need powder form, some people may need decoction, and we are here to determine that based off of what's going on in our bodies. So decoction is a process where raw herbs are boiled, and they could be boiled from 10 minutes, shorter periods of time, to 30 to 40 minutes. It is such a powerful, potent way of administering herbs. Unfortunately, we don't do it as much as we would like because we live in a very busy world and it's hard for people to be able to cook their herbs. And so a lot of times we end up providing people with powder. Powder herbs can be equally as efficient and very, very powerful also. And so those herbs are generally ground into powder, and they're either given directly to the patient or turned into an extract via a secondary process of boiling or an evaporation. So this is a very, very common form of customizing herbs for people. We've also got tablets and capsules. So this is for the folks that come my way that are just like, I cannot stand the bitterness of these herbs, and I get it, they can get a little bitter. And so we can also, we generally encapsulate herbs, and they can be very beneficial in that there may be a longer absorption process, and sometimes that can be helpful for some people, and they must first be like, because they're going to be dissolved by the stomach or in the stomach. Perfect. So then we've got tinctures. I mean, I'm sure many of you may have already made some tinctures or heard about tinctures. Tinctures are pretty awesome because they're very powerful when it comes to certain types of pain in the body, and they can be also very supportive for the emotional body. And so they're soaked in a grain-based liquor, so the alcohol can extract out key ingredients, and it can be taken again in the same way that any other herbs are taken through. So maybe like once or twice a day, based off of the condition. So we've also got topical herbs. We are all, in our medicine, we're all about treating the root cause. So a topical herb sometimes may be important because it's not as a serious condition. So we could be using these creams, ointment, and plasters to deal with some rashes or issues with the skin. But for the most part, a lot of these issues, and you may already know this, are a reflection of what's going on inside. So you will likely see an ointment or a cream combined with another form of herb that you will be able to take internally to be able to really, really get to the root cause, because we don't want to just deal with the branches of the situation. Perfect. So here we have an assortment of amazing tinctures that we sell here at Align Modern Health. And I am a major, major fan of Griffo, and I think that it's a very, very ethical and amazing company. And the beauty about it is, I mean, look at those beautiful bottles, but at the same time, you've got these amazing herbs that are combinations of formulas that have been around for a very long time. And they're so beautifully put together, and I get so excited giving them out to my patients all the time. And I've seen amazing, amazing results with them. So if you do ever choose to come our way, and if you're already here, you may have already experienced them, but yeah, so this is one of our ways that we support our patients here. Perfect. All right. So I am going to go ahead and start answering any of your additional questions that you may have in the Q&A session. So if you wanted to type questions, I will definitely take some time to answer some of them. And I will start now. Perfect. So I think someone was asking about how to take something about how to take the herbs. That's a great question. I think, sorry, just checking. So how do we take them? I imagine it might be for the tinctures. Maybe whoever wrote the question can actually confirm. The way that the tinctures work is you would obviously need to come in for a consult first, because we would want to assess what's going on for you. But once you do, you would be mixing them with like a little bit of water and drinking them 3 times a day, sometimes like 15 to 20 minutes before or after meals, away from any medication. So we would be instructing you about all of that if you were to definitely come in. Another question that I have is, what are some herbs that help with anxiety and mood disorders? You know, that's a really, really great question. And I think like it goes back to what we were talking about earlier. And there isn't one herb that's going to do that. And there might, because it all depends on what are some of the root causes of what's going on for someone. So even if I were to tell you one herb that does support with anxiety and mood disorders, you may take it and may not feel any results, or it may worsen the anxiety. And I think some people may have already had that experience before. And it's usually because of the fact that we do need to look at we do need to look at the constitution of someone and what's going on for them. But one example I could think of is pearl powder, for instance, or you've got hematite. But again, a lot of herbs that I would not recommend to be used without instruction and without a practitioner, because dosage matters, and they can definitely make a difference and be very, very effective or harmful in some ways. Are there alternatives if spicy tasting herbs are difficult to take in? Definitely. So it may also be sometimes that you may not need spicy herbs. I think a lot of us, the beauty about spicy foods, and I love talking about spicy food because we live in a society where either people are too sensitive to spicy food or they're just so obsessed with spicy food. And there's a component, capsaicin, in spicy foods that allow people to get emotional relief, which is why so many of us go to spicy food for support. But it generally is not the best herb, or spiciness is not the best herb for most conditions, and you would have to really look into why this person may need it. So and the spiciness would never be strong enough for you to feel like a burning sensation when it's being ingested. So that's something else to also consider. Thank you for those questions. Wonderful. What are some herbs that help with fertility for both male and female? So such good questions. This is so exciting. For fertility, you know, again, I'm so sorry I keep repeating myself, but I have seen people benefit from so many different herbs based off of fertility. Because fertility could be connected to different stress factors, it could be connected to hormone factors, it could be connected to age issues. So every single one of these categories is going to allow me to customize a particular formula for someone. And I know I keep emphasizing that a lot. And I imagine people are keen to know, because I know someone mentioned on here that they love the idea of having home remedies. And I think this is where like nutrition becomes is very important, because really ultimately nutrition is an equal amount or an important amount of will offer us an important amount of support too, along with herbs, or herbs in our nutrition, of course. So, can herbal medicine treat allergies? So that's a really good question. I think that in our medicine, from what I've seen, there are customized formulas that can definitely support the immune system, that can definitely support regulating hormones that would allow for those results. I have seen people who have had allergies be aggravated for some time and be gone also after a certain amount of time. Would I say I'm treating allergies? I might reframe that and say I'm treating the environment. So I'm treating your body and supporting you as your immune system more specifically. Are there any side effects of taking herbs? Yes, there are definitely side effects. There are always side effects, which is why it's important to talk to a professional when we're working with, or at least you're coming in with herbs, because they are being processed. So like you hear a lot of people causing harm to their bodies. And sometimes there are simple herbs that can be used on the day-to-day. Like we can't regulate herbs, they're all over. So I don't want to push people away from actually doing having access to herbs, but I do want to recommend that there are certain professionals that can also either deter, like push you away from certain herbs and direct you towards some, or maybe confirm that the ones that you're already thinking of do work. Is there a typical average time people start to see results? Good question. Yes, some people will not even need herbs in the medicine. I've seen people get immense amounts of support with like IBS, for instance, within 2 sessions. With herbs, could be long-term. So if you've got stress factors and you're continuously being stressed or feeling stressed because of certain environments and triggers, then it may take some time to regulate the mind and actually help those neurons fire a little differently so that you can get the support that you want. So, and another example could be fertility. So for fertility, we generally ask people to come in for 3 months to regulate their cycles before we can start to begin to see results. Perfect. So some of these questions I really do want to be able to answer, and some I want to also answer in person, because part of me just would want to delve into a lot of this stuff, and trying to see here what else that could so a lot of it is okay, herbs that would help lower cholesterol. There are some herbs that do that. I can give you a simple herb that we've used, corn silk, for instance, that has the ability to do that. Would it be the right herb for someone who's asking about it? Again, would depend on the constitution, but definitely one example could be corn silk. Male infertility, are there herbs that can help with that? Yes, definitely for male infertility, lots of amazing herbs, some definitely really strong seeds that can help with that. And really with the sad thing about male infertility is that generally folks are not told that there could be issues with fertility on the men's side. And so I find that to be really interesting and fascinating to get more men into spaces to heal and support their bodies also. So because it's a 50-50 thing, and so allowing people to heal, and definitely a lot of herbs, some of them are similar to those that you would give with someone with like a woman also, or someone with a uterus. Can we overdo herbs? Definitely, we can overdo herbs. Most of us are familiar with that. You could still see side effects sometimes because of overdoing herbs. But generally, our side effects, if you are with a good practitioner, could look like diarrhea, for instance. So you could give someone the runs, or it could look like someone may be getting a bit of dehydration. And yeah, like I would still say this is why I'm very careful with my herbal recommendations. And when I'm giving out a customized formula, I trial test it, because even if I am sure about a certain diagnosis, I still am careful, because we're working with humans. Our bodies are so different. A lot of people have different forms of medication, so I have to be able to be careful about what I'm prescribing, and definitely can't overdo it. We do offer virtual appointments. We do offer 30-minute consults, so 15-minute free consults. So that's what I was going to get into, but also 30-minute consults for herbal support. So I think one last question someone mentioned. Oh, regarding herbs regarding lowering cholesterol. I had mentioned corn silk. So for the person who was just about to step out, it's corn silk. But again, I would recommend getting a consult before you do some of that support. And I do think that working with Western and Eastern medicine would be really helpful for cholesterol. So again, more conversations to have about this. I do like to be especially careful and detailed with this stuff, because I'm a person who really believes in integrating different forms of medicine. I don't shy away from people, or I'm not afraid of Western medicine either. I think there's space and time for everything. So when I say I'm here, I support herbal medicine. I'm talking about how is it that we can integrate it into the world so that we can make more use of it too, along with forms that are already accessible to us. Perfect. Okay. So, man, so Barbie just wants to answer everything. But I just want to take a moment to like really thank you all for coming in today. I don't see your faces. I can't see all of you here, but I am still equally as excited. And I hope that you even got like a tiny little bit a tiny bit of excitement from what I shared today, or just a tiny bit of more information that you may have needed. If you are interested in getting any kind of support, or are interested in getting some of your questions answered that I couldn't go over today, please consider to schedule like a personalized free 15-minute consultation, and you can call 773-692-6700 or visit us at alignmodernhealth.com. So yeah, that's all for today, and thank you so much, everybody. Thank you for allowing me to share all this wonderful information with you, and have an awesome day. And I hope to connect with some of you in person or virtually. All right, take care, everyone. Bye.